So in this video, we had a request to look at degenerative myelopathy and Wobblers syndrome. So absolutely, we can use laser therapy to treat both, but they are very different diseases. So our reasons for treating both are equally different. So our Wobblers syndrome is typically a compression within the cervical vertebrae, and our degenerative myelopathy is a degenerative disease of the spinal cord, normally starting within the thoracic. Both, like I say, impacting the spine, but the Wobbler syndrome more typically painful. And degenerative myelopathy, it's not necessarily the pain we're looking to treat, more the neurological kind of impacts themselves. So our aims and goals are slightly different from one disease to the other as to why we would use our laser, but equally can be beneficial. It's important to say from a compression perspective for Wobblers, obviously laser is not going to fix that compression. So again, we're looking to manage any pain inflammation as a result of that. And obviously with our degenerative myelopathy, again, we're not curing the disease, but what we're looking at is can we ultimately delay that progression of the disease. So in terms of research, interestingly, so not as much on Wobblers syndrome, but degenerative myelopathy, there's a really interesting study, and I really recommend you take a look at it, that was, it came out a couple of years ago. It was a retrospective study where we essentially, long story short, had two groups of patients that had absolute diagnosis of DM. And we had one group that had low dose, low power, low irradiance. So those three really important points. And we had the second group that had high dose, high power, high irradiance. Again, really key point here when we're looking at the study. And what they found, they had the same rehabilitation program, home care plans, etc. What they found was that the group that had the high dose, high power, high irradiance had an average survival time of 38 months. Now, bearing in mind the average survival time for a degenerative myelopathy patient is on average 12 months, and the low dose group had an average survival time of 11 months. That clearly shows, we're not talking about, they had a couple months extra here. These guys literally doubled, if not tripled, their life expectancy in terms of by having high power, high dose, high irradiance delivered. Absolutely a clear difference there. So absolutely, laser has been shown to be beneficial. We're still learning a lot more, and it'll be really interesting to see where the research goes around this in the next few years. Okay, so how do we then put this into practice? So we either have a degenerative myelopathy or a Wobblers or any kind of spinal case that we then want to apply our treatment to. And I'm going to use my friend Bones here to help me demonstrate that. Now, depending on what disease we're looking at, so let's take Wobblers. We know, generally speaking, that the compression is going to be within the cervical spine. So that is always going to be our target here. And as everything else that we treat musculoskeletal, we want to treat anywhere else that we believe is going to be, there's going to be some compensation. So for me personally, if I can treat cervical and at least thoracic, that's the best way forward for me. However, when we're treating something like degenerative myelopathy, and almost, to be honest, any time I'm treating spinal, I prefer this way, but definitely when it came to treating degenerative myelopathy, and we saw this as a result in the study, we want to treat the entire spine. We don't just want to treat the segment, because ultimately this is all connected. If here is impacted, there's a chance that there's going to be some, again, compensation going on, or some effect kind of lower down in the spine as well. Equally, if we had something that was impacted down here, up here and down here is going to be naturally impacted. So whereas with things like Wobblers, we can probably get away with treating more locally, even though I do recommend treating as much of the spine as possible. Definitely when it comes to degenerative myelopathy, we want to treat the entirety of the spine. And we know that ultimately that's what's going to happen. Whilst we might see the initial kind of stages happen kind of in one limb, we know that ultimately all 4 limbs by kind of end stage are going to be impacted as well. So wherever possible, treat the entire spine. And then how are you going to apply it? So again, we know that if we use contact treatment, we get up to 67% more light to reach out at deeper tissue. So there is again a study done where a photodetector was placed underneath spinal cord and in a cadaver, and they use contact versus off contact to see how much light would reach that photodetector. And we found that contact treatment, as long as it's appropriate, delivered 67% more light to that photodetector. So wherever possible, we want to use contact treatment, especially on our spine. And the mistake a lot of people make is just kind of running the probe up and down across the spinous processes. That's going to be quite uncomfortable and not actually going to be the best way of targeting. So what we would kind of recommend is that you kind of travel alongside the paraspinals, zigzag across. So you're getting into that, all the words gone, spinous processes, in the middle of the spinous processes, intervertebral disc space is kind of what I'm after. And then you'll go down the other side, kind of those paraspinals as well. So you're not kind of just going up and across, you're kind of coming down, along those paraspinals and zigzagging through those intervertebral disc spaces, and then alongside those paraspinals on the other side as well, and you can kind of do this pattern kind of across there. Ultimately, like we say, kind of we're targeting kind of through those muscles. Not only are we then trying to target kind of what's happening around that disc space, but also those muscles as well. So we're impacting both sides. So ultimately, absolutely, we can treat degenerative myelopathy and Wobblers syndrome. There's different reasons, and always go back to the basics of we use laser for pain, inflammation, help with tissue repair, help with vasodilation, blood supply, etc. So always go back to what is the disease in front of me, and then, does it tick one of those boxes for the laser? If yes, go ahead. And particularly with degenerative myelopathy, it's really important, anatomically wise, treat as much of the spine as we possibly can. Don't just kind of segment, as you'll have the best results if we're treating the entire spine. The only other point to point out here is also dosing. So going back to the study we mentioned earlier, the dose rates they used in that study was 14 to 20 joules per centimetre squared. So that is a much higher dose than the average 8 to 10 joules per centimetre squared that we see in deep tissue conditions. We've been seeing this change in that dose rate across a lot of the papers recently when we're looking at deep tissue musculoskeletal. Using that 10 to 20 joules per centimetre square range is getting better results for various reasons, and we can do a whole video on that as well. So if I had a DM case in front of me, treat the entire spine, contact wherever possible, treat the paraspinals as well as that intervertebral disc space, and then use an appropriate dose to make sure that we're going to be, again, dosing those tissues properly. I hope that helps in terms of how you would treat either condition, and obviously if you have any questions, please feel free to reach out. Also, don't forget to like, subscribe, comment, ask any questions, share this video. The more that you guys do that, the more content I can create for you, more education. Please check out our YouTube channel, Emily the Laser Trainer, because again, we upload so many videos, longer educational videos onto there as well.